Do you ever wonder why some men are showers while others are growers? Which one are you, and how can you fix that? Well, first, let's talk about why this happens. The smooth muscle in the penis, or the corpus cavernosum, is very similar to skeletal muscle in the fact that it constricts and it relaxes based on your need. So think about it. When you're lifting weights at the gym, you're contracting that muscle, and then you put the weight down and now you're relaxing the muscle. The same thing happens. So when you're actually relaxed, you're allowing maximum blood flow to flow into the penis and fill your sinus cavities, allowing for an erection. In a flaccid penis, you are causing vasoconstriction, which means that you're not allowing rich oxygenated blood to fill up those sinus cavities in your corpus cavernosum. That's why you're not full or having an erection and you are constricted. Or maybe you are that, am I a grower versus a shower? That's what that's about. Another reason why you're smaller in a flaccid state has to do with the sympathetic nervous system. As we discussed in earlier videos, the sympathetic nervous system is your fight or flight. This is when your body is trying to run from the bear. It's trying to protect you. So it causes vasoconstriction of all blood vessels, meaning that all of your rich oxygenated blood is feeding your heart so that you can run fast. So if you're not sending all that blood to the penis, it's gonna appear smaller. Now, what I want you to remember is how exactly you get an erection. Remember, it has to do with sensation, vibration, tactile stimulation. You have to touch the penis. When you touch the penis, you're actually activating the nerves within the skin of the penis. And this activation of the nerves sends a signal back up to the brain, which tells the brain to stimulate your parasympathetic nervous system. This is your rest and digest. This is your relaxation, your calming, so that you can get all this rich oxygenated blood down to the tissue. Now, once you've activated the parasympathetic nervous system in your brain, it then sends a signal all the way down your spinal canal back into the endothelial cells. The endothelial cells are what line your blood vessels, and these cells are responsible for secreting nitric oxide and acetylcholine. Both nitric oxide and acetylcholine causes more vasodilation, meaning more blood flow to flow into these sinus cavities so that you can get an erection. Once the maximum amount of blood flow has entered into these sinus cavities through your arteries and your veins, these veins will then compress up against the tunica albuginea. When this happens, it doesn't allow the blood to backflow, meaning that your penis is keeping all of that blood in the sinus cavities so that you can have this strong, firm erection. So what can you do to change the way that you appear in a flaccid state? Why not try Botox? I know you've heard of Botox. Botox is all over the commercials. It's being used for cosmetic purposes. In essence, it's going to reduce your wrinkles, your fine lines. It even is used for migraine headaches or something called hyperhidrosis, which is excessive sweating of your palms and your feet. Why is this used so much? Well, because it actually causes flaccid paralysis. Botox is a neurotoxic protein that prevents the release of acetylcholine from entering in the neuromuscular junction. Why that's important is because acetylcholine causes contraction of your skeletal muscles. This is why you can actually run or walk or talk or chew because of this neurotransmitter. So when Botox is injected into skeletal muscle, it inhibits the release of acetylcholine. Why that's important is because acetylcholine is responsible for muscle contraction, which is why you can walk and you can run and you can talk. So you do need this neurotransmitter. However, if you think about it in terms of cosmetic, when you're causing this contraction of the muscle, you can start to develop fine lines. This is why Botox actually came about. It causes this flaccid paralysis of this skeletal muscle. Not allowing it to move will then reduce your fine line appearance. Now, in the case of a flaccid penis, most men will appear smaller in a flaccid state, and then they grow once blood flow goes into the sinus cavities to cause an erection. So we get a lot of guys into the clinic who will say, is there anything I can do to actually expand this shrinkage that I'm experiencing at rest? And my answer is yes. You can use Botox to inject into the corpus cavernosum because the corpus cavernosum is very similar to skeletal muscle in the fact that it responds to movement, constriction, relaxation. So when you inject Botox into the corpus cavernosum, you're actually inhibiting the acetylcholine from going into this neuromuscular junction, thereby causing this flaccid paralysis, not allowing that constriction to happen in the penis. So when that happens, you are able to hang just a little bit longer. What about scrotox? Yes, I said scrotox. Injecting Botox into the scrotum. Yes, we do have men that come into the clinic that are concerned about the appearance of their scrotum. Maybe it's too constricted, it's too wrinkly, or maybe they're having excessive sweating in their scrotum. How can we fix this? Just like we talked about, you can inject Botox into the scrotum. And again, this is very similar to skeletal muscle in the fact that it's going to release acetylcholine, causing movement and contraction. So if I can inhibit or again cause flaccid paralysis of these muscles, then I can actually allow the scrotum to relax, hang just a little bit longer with more surface area so it doesn't have so much heat. You'll reduce your sweating and it will just look a little bit prettier. So if you're interested in either Botox for the penis or Botox for the scrotum, come on over to Novus and let us help you.